Tchang, great to see you in Texas. We're out of our comfort zone, it looks like, because we're in a venue where there's so many different types of influencers and digital media and content creators and all these different walks of life. I think it's fascinating that we get to be here.
I think this is really going to be a new experience for me. I've never been to a convention before. The amount of information and content, exactly as you say, kind of spans all pieces of life.
Yeah.
And as a doctor, I really live in this biology sphere and health sphere, where I talk to patients and I work with medications, and so I don't often get to get out of my comfort zone to really interact with everyone else who's not in my little bubble.
Yeah, it's been pretty interesting. I mean, it's the same point. I've never been to South by Southwest before. I've been here for roughly 8 hours or so, and it's been incredible in terms of how much different discussions going on in different areas. I literally had a conversation with somebody, and they were just here to be here about absorbing information, and I'm like, wow, you have that kind of time. That's pretty impressive. It's incredible that to kind of take yourself out of a normal environment. Because I'm like you, where we go to a scientific conference, or in our case of being an operator, we're at a healthcare investment conference. It's a different genre and audience. Here, it seems like a lot of people are really interested in information absorption.
Yeah.
And they are trying to do the intersection of disciplines and seeing how does technology correlate with science and stuff. So
I think you pointed out something interesting, which is as you just walk the halls, you see so many people on their own cameras, on their own phones and computers creating content. And then there's 300,000 people registered for this convention.
Yeah.
So there's a lot of people consuming content. So I almost feel like we're in real life version of social media.
That's true.
Where you are meeting all of the people online, but in real life.
Yeah.
And I think that's really exciting, because then you really get to connect with an audience who wants to hear from you about the little details and nuances about #Ozempic or weight loss therapies, or what's the newest in obesity and how are the GLP-1 revolutions affecting every industry.
Yeah, that's a great way to put it. So let's talk about that for a second. So if you were to think about this audience that we're communicating to, because tomorrow we're doing a panel, which is really exciting. I think it's a great opportunity to bring attention to the work that you're doing, the work that we're involved with. But there's so many myths about obesity, I feel like. And if we think about the audience that's here in Austin, how would we communicate that about what we're doing to capture their attention span? Because we're talking to an audience that I feel like is used to absorbing information in sound bites.
Yeah.
So I think we have a technical subject, but at the same time, there's a component of breaking down some of the common things that they might absorb in 10-second spurts.
Yeah.
But making it.
So I would say my 10-second spurt is, everyone cares about health and how do we preserve or better our health.
Yeah.
And as a doctor, I've been addressing health from the medicine side, medical side. And I think the rest of the world has been thinking about it from the wellness industry.
It's true.
And there's a little bit of this divorce, I would say, between medicine and wellness that shouldn't have to be there, because we both have the same goal of health.
Yeah.
And that goal, I think, is something we can really bring out as the main message when we're in a convention like this where we meet everyone from everywhere.
So that's so fascinating you say that, because I was looking at the program. The program here is overwhelming. Today, there was panelists like Peter Attia, and later on in the week we have Brian Johnson.
Yeah.
These people that are influencers in the whole biohacking and other longevity space and all that stuff. So you're right that here we're talking about pharmaceutical intervention on chronic obesity, which maybe is a mouthful for a lot of people to understand. But it's been around for a long time.
And I mean, call it what you want, whether it's obesity, whether obesity is a disease or obesity is not a disease, whether medications should be available or not. You can call it what you want. I think the crux of it is that we all share the same goal of achieving and protecting health.
Yeah.
And I love, what Dr. Attia does, Brian Johnson does. I think they're experts in really translating what we understand as science experts into the mass media. And in that way, we can have better informed conversations because we have better understanding of what our goals are.
It's true, like we're living in an era where information is definitely absorbed in many different places and formats, and I'm really glad that South by Southwest has opened up to not only talking about like what's happening in the media and film, but now cross-secting into like the tougher other industries like the medical community and life sciences. And I think that obesity is one of those things that's become a very topical thing, like you mentioned. It's on everybody's radar, or it's definitely come into the mainstream in terms of the vocabulary.
Yeah.
But many people still don't appreciate that it's not a condition that's just something that can be addressed with like willpower. It's like there is people that need medicine as intervention to really push them to adapt to lifestyle changes and other things. So maybe you can just highlight that from your experience, because you've been at the forefront of like some of the stuff that's been ongoing in the dialogue on social media and stuff, and you're a very strong advocate on X. Have you seen an uptick of different people engaging in that conversation, and people that are informed versus uninformed, and that being easier to dissect?
It's really been a fascinating evolution of who is interested in weight management, obesity care, weight management, whatever you call it. I think in the beginning, as a doctor, all you see is the patient in front of you. And oftentimes these are patients who are sick. They have some kind of health issue in addition to the weight that has brought them into my clinic. But I think because of social media, because of celebrities being more open with their personal lives, because of the telemedicine and telehealth industry too, that conversation around who is interested in weight care has expanded exponentially. So the people now who are looking about weight management aren't sick people, per se. They're not 50-year-old person with a history of high blood pressure or high cholesterol who wants to lose weight. They're 42-year-old woman who is in the beginning of perimenopause, or a 35-year-old woman who just had 2 children and wants to help with the pregnancy weight and kind of get back to where she was before. Or it might be a dad with a daughter who's 18 years old and wants to get ahead of the problem, because we're seeing how weight is a problem across every age generation.
Or they want to have they're better understanding what that metabolic process is, and they're more informed. So the integrative medicine has been an interesting topic that's been on my brain, because you have now the availability of drugs through, compounders and other things that's been very controversial. But let's just talk about, like, there's the extreme of people that are taking over-the-counter products that are in the biohacking sphere, and then there's the other extreme of pharmaceutical intervention for people that need that kind of intervention. But there's also others that are looking at metabolic shift or aging or longevity, and I think there's this division of like a more like integrative medicine, where there's doctors out there that are interested in helping push the patient into being more informed about their body, like you're saying, even in certain demographics, like you said, the perimenopausal women. Is that something that you've noticed in your practice? Is that there's other doctors that are starting to come into this field that are trying to push into the, hey, like into that more
integrative
general,
medicine
into the general space,
in some ways, I would call it the less evidence-based
Yes.
space,
Yeah.
to be honest. But I think that that's, not a feature per se, but a problem to be solved. This lack of evidence in the integrative medicine space. The truth is that, and this is particularly true about obesity, is that weight management has existed in this gray area for so long, where we couldn't really treat it with medications. So people had to go to integrative medicine or supplements, lifestyle, kind of all of the other modalities to treat that.
Yeah.
But now we have something that is evidence-based, scientifically backed from our medical side to also treat obesity. So weight has always existed in this space of needing both types of providers, whether it's those who are really talking about medications or those who are looking at just lifestyle and supplements.
Yeah.
We need both type of providers in that space. And that means we do have to work together and try to figure out how do we establish a better series of research studies that would show the safety and efficacy of supplements or lifestyle interventions.
Yeah.
How do we ensure that the pharmaceutical options are being used in the right populations as well? And that really requires all of us to collaborate.
Yeah, I think like one of the fascinating things that we can get out of an environment like this is leave very inspired about what we're doing is touching a lot of people, and there's a lot of ways to spread the information of the type of research that's underway. And then the fact that we're living in an industry that's evolving really quickly. So I actually am inspired by seeing all these content creators and digital mediums and like films and television and all of the stuff that we're influenced by, because we have those platforms to use to marry some of the work that's happening in the pharmaceutical intervention space to make its way into helping with lifestyle changes, and those platforms helping, like exercise, for instance, is way more democratized than ever. And I think that helps in terms of the lifestyle changes that would help alongside with medicine. So I hope that these types of conferences continue to do and continue to help provide that platform. And so I'm looking forward to tomorrow's panel. And
I have no idea who's going to show up. It'll be interesting. I'm very excited to hopefully grab a part of the population that hasn't really thought about this that much before. Maybe they thought about it a lot and had many, many questions and didn't have like a doctor or an expert scientific expert to ask their questions from. Like I said, usually I see people who are older and sicker. If I have the opportunity to talk to people who are in that beginning stages of health and how do I preserve health from a weight management, metabolic, or longevity perspective, then this is the best opportunity.
Looks like we already have an audience here, which is great. It's like fascinating. Thank you so much.
Yeah.